Hello friends, this is Dr. Sitesh Roy, your super specialist in immunology, allergy and asthma, coming to you with this special on asthma and COVID-19. Friends, since the beginning of the COVID pandemic, many of my patients, their families, also colleagues have had many questions about the risks that an individual with asthma has when it comes to COVID-19. It was initially told by the WHO and several national or international organizations that people with asthma are at greater risk for COVID-19. Now, about 10 to 11 months into the pandemic, we have a lot more clarity about this with data from China, from Italy, from Spain, and from the US, which suggests that people with asthma are at no higher risk of developing COVID-19 than a person without asthma. And this is based on studies of people over 30 to 70,000 people who have been looked at in sequential manner in different research around the world. What is important to know that if there is a risk for a person with asthma developing COVID-19 or developing COVID-19 to the point of requiring hospitalization or getting it severe, there are certain factors. One, age above the age of 55. Second, gender, being a woman or female. Third, being a smoker increases the risk. If a person has asthma and is a smoker, their risk goes higher of developing COVID-19 complications or having it more severe. Also, people who have comorbid conditions like obesity. So an asthmatic who is also obese does increase their risk because of the obesity, not so much because of the asthma. Similarly, those with hypertension, heart disease, those with diabetes, those with dyslipidemias are all believed to be or found to be in research to be at a higher risk of developing more problems if they were to contract COVID-19, recognizing that just having asthma doesn't put you at a higher risk for getting COVID-19. The second important question that I get is, Dr. Roy, we were initially heard messages that steroids should not be used during COVID-19 pandemic because it lowers the immunity. Is there any truth to that? And should we continue to use our inhaled steroids, that's our inhalers, or should we continue to use our dry powder inhalers with bronchodilators in them? So the answer to that is also very obvious and clear. Steroids have actually been found to have a protective effect on the lungs when it comes to COVID-19. And in fact, when a comparison was done of people with COVID-19 having asthma and taking their inhaled steroids and people with COVID-19 having asthma and not taking their inhaled steroids or combination inhalers, it was found that the people who were not taking their medicines were at higher risk of getting the disease or getting it to a greater intensity. So rather than just having it mild, having it moderate or severe. So all of this implies that please continue to use your asthma controller medications, your inhaled steroids, because keeping the inflammation in the lungs under control, one, reduces your risk of severe COVID. Second, it also prevents you from having to go into any kind of a healthcare facility, whether it be a clinic, a hospital or an emergency room, where your chance of getting exposed to COVID-19 goes up. So if you take your medicines like you were before the pandemic began and keep yourself under good control, stay in touch with your asthma specialist, get your regular follow-ups done, whether it be online or in person. And by doing that, you will reduce your risk of one, getting COVID, and two, also if you get it, of having a severe outcome from it. The third question that I get, friends, is can I exercise during these COVID times? And again, my message right from the beginning of the pandemic and all my videos I've done so far, I have always said that physical exercise and activity is the way by which you keep your endurance, your stamina, your fitness at the best, regardless of whether you have asthma or not. And I believe people with asthma should even more be encouraged to exercise. And if you're not being able to exercise because of the asthma and because of becoming breathless or having chest tightness when you try to do exercise, it means your asthma is not under control. You need to be seeing a super specialist for asthma and getting your asthma under better control, because people with asthma should be able to run, jog, exercise, swim, cycle, do aerobics, do yoga, pranayam, and all of these things will also keep you healthy, strong, and keep your immune system boosted, besides keeping your mind happier and healthier. And remember that keeping your stress down and keeping your immunity strong are directly connected. So friends, hopefully through this video you've had a lot of your questions regarding asthma and COVID-19 answered. If there's still something that I've not covered, feel free to write it in the comments box down below this video, or message us about it, and we'll be more than happy to discuss it in the next video. The final and most important message: do take your influenza vaccinations, and when it's turn to take your COVID vaccination, depending on your risks, your history of allergies, other vaccinations that may have given you a reaction, do take your COVID vaccine also. Feel free to connect with us if you have any questions. If we can help out with giving you your vaccination safely, we'll be happy to do that. Till next time, take care, stay safe, God bless us all, take care.